Continuing with the first class under healthcare innovation and entrepreneurship, in module 1 we have covered the overview of the healthcare industry landscape. So, under the healthcare industry landscape, under the healthcare industry landscape, we have seen the global landscape, and thus we have understood the statistics, the drivers, the growing factors, the trends, the leading countries right now in this healthcare industry. And next we have understood and we have gone through the Indian healthcare landscape, and here we have understood the doctor to population ratio. We have seen the government initiatives that is taken from the Indian government, the challenges, opportunities, and also the market size and the structure. So today we will be going through the second topic, that is the need for innovation in healthcare. So first we have to understand the need for innovation and entrepreneurship in healthcare. Like, what is that? Innovation and entrepreneurship are vital in addressing the gaps in healthcare industry, affordability as well as in access. In a rapidly changing environment, healthcare innovation can improve patient outcomes, reduce costs, and empower both providers and patients. The most important question is, why is innovation needed in healthcare? The points that is covered in this slide. The number one thing is the rising costs. That is, innovation helps reduce treatment costs. Number two is access to services. Digital platforms can bring urban-rural divides. Number three is challenging disease burden. Innovations in diagnostics and care for non-communicable diseases, for example diabetes, for example cancer, for example tuberculosis. The number fourth is workforce shortages. So artificial intelligence, robotics, and mobile healthcare can help fill the gaps, that is the gaps created by the workforce shortages. In the next slide, what is there in the next slide? Under next slide we will be understanding role of entrepreneurship in healthcare, right? So the we have seen the importance of entrepreneurship. So the first key area of innovation over here is telemedicine and electronic health, or in layman's language what we say is e-health. The applications such as Practo 1mg and others helps to connect the patients to doctors virtually, that is not face to face. And COVID has witnessed a situation where virtual consultation with the doctors is so very much needed in today's landscape. The next one is wearables and remote monitoring. Devices like Fitbit, Apple Watch, Android Watch, these kind of wearable devices is helping us to track our health 24 into 7. Next is AI and big data, which is used for diagnostics as well as predicting outcomes. So suppose we will be needing the data for last 15 years, 20 years, and I want to analyze that which trend of disease is going to come after assessing all the 15 years data in the future 10 years. So it is not possible for any kind of technology to do so, to do those assessments. For those reasons, artificial intelligence is very much needed, which plays a big role in solving these big data and help in understanding what in future is waiting for us. The fourth one is affordable diagnostics, portable ECG machine, low cost testings, and portable pharmacy services, as well as portable radiology services, pathology services at home. These things are coming forth as affordable diagnostics, which is coming door to door, and we don't have to travel, or we don't have to reach to the traditional pathologies. We don't have to reach to the traditional pharmacies. People are coming to our home and doing the service for us. If you talk about government and policy supports, the number one is Startup India. So in under Startup India, it promotes healthcare startups. Number two is Ayushman Bharat's digital mission. It integrates digital health records. Number three is biotech parks and incubators. It encourages innovations through funding and mentorship. The challenges of the innovations are: number one is regulatory hurdles. Various legal aspects are there which can be a big challenge in inaugurating these kinds of like these kinds of advanced technologies in healthcare. Number two is limited access to early stage funding. A huge amount of funding is needed for this changes. These machines, these portable things cost a lot and these to arrange these kinds of huge amount of funding can sometimes be a challenge or a bottleneck. And number three is infrastructure limitations. As I already told in my first class that infrastructure is so very much needed in healthcare, not in healthcare, in every industry infrastructure is needed. Without infrastructure nothing is possible. And if we want to infuse a good and a advanced digital healthcare in our lifestyle, in the lifestyle of our patients, we will be needing an advanced infrastructure to support that. So that is a very important thing, and without which it can be a huge challenge. The number fourth is resistance to technology adoption. We all know that people are already accustomed or already used to this traditional healthcare services, right? So for people who are already used to this, who have already seen this from the start of their healthcare journey, sometimes it becomes a problem for them also to adopt new things so easily. So the healthcare policymakers has to wait and make people understand that what are the advantages which are going to come with if they adopt this kind of new healthcare services. The next slide is case studies in India. Okay, so under case studies in India, we will be seeing few points which will be discussed in the next class. So for today we are ending the class with the need for innovation in healthcare and the role of entrepreneurship in healthcare as well. Thank you.